I think it's fair to say that one of the most common misconceptions that people make is that if you have some kind of mental illness like dementia, that automatically means you don't have testamentary capacity, which isn't true. So this testamentary capacity is quite a low bar. So you could have testamentary capacity and have dementia at the same time. One of the first things that we would do is we would obtain the medical records if you had a doubt about testamentary capacity. It used to be the case that you had to be the executor to be able to obtain these GP or hospital records, but now it's a lot easier to do that if you're an interested party, i.e. interested in bringing a claim. Me as your solicitor would be able to get those records for you, and we would have a look at those to see what evidence there was about a client's or the testator's testamentary position, you know, what their capacity would have been. It's quite difficult sometimes, and particularly now because we're coming out of wills and disputes that have arisen during COVID. People weren't going to hospital as much, so they weren't all doctors, and they weren't having a diagnosis of dementia. You know, so it's not on their medical records. There might be things saying they fell and they were confused, or, you know, things that add up to maybe having dementia, but nobody ever went in for a mental assessment or got seen by a psychiatrist or whatever, because that sadly didn't take place in COVID. People were afraid to go to the doctors because they thought they might catch COVID, or, you know, doctors just weren't as accessible. So we're seeing now cases where, you know, there was no formal diagnosis, but that doesn't mean to say that dementia didn't exist. So you would need to obtain medical evidence, you know, after the person has died, and then they look at the records to give an opinion as to whether they think that person had capacity or not at the time of making the will.